At the moment, there is very little support for people with mental health problems early on. If someone is experiencing a low mood or anxiety, which 1 in 4 of us could experience at any point in life, there is very limited support in the community. So the options are very limited. You can go and see your GP. GP may prescribe a medication, or GP may refer you to a mental health service where you get the treatment. Parity is a major issue in mental health because physical health care, it starts from people. If you have a physical health problem, you're more likely to actually recognize it early on. You're more likely to approach a GP and get the treatment, where if it's a mental health problem, stigma prevents you from accessing services. So there is a parity issue start from there. The support available around the GPs for conditions, if you compare it to diabetes or hypertension, people with mental health problems do not have the same range of support available, and it is at all levels, the parity issue. So the mental health pathway would address some of the parity issues by bringing more resources in the community, and it won't be mental health services alone. It will be a range of voluntary sector organizations working together and building that support in the community. So that's the focus of the pathway. So the new model, you have a variety of support early on that you can access within the community. So if you go and see a GP, at the moment GP can give you a medication, refer you on to another specialist service, but in the new model, GP will have a range of options they could refer you on to get the right support. It could be support with finance, it could be support with the social situation, it could be being part of a group which could provide a person with support. So you have more range of interventions or support people could access early on in the community. The assumption is if you can make that work, the number of people going to GP or the number of people actually going from GP to a specialist services, we should be able to reduce. So that would reduce significantly the pressure we have on the acute mental health pathway, where actually people with more serious mental health problems need treatment. So if we can reduce the pressure there, we can actually provide a much better experience and better care for the patient. So if they come into the hospital, they have to come in at the right time, sometimes earlier than what's happening now, but they stay shorter in the inpatient unit and back to the community with good support. They don't need to stay in the inpatient unit to get that support. They can have the support back in the community. So it's about making the care, the right care available early on in the patient pathway and reducing the need for patients to see more specialists or spend time in the hospital. That's the focus of the mental health pathway.